morning, ma'am. I am Jomela Jimenez Alvis, your student nurse from Camarines Sur Polytechnic College. So for today, I am going to demonstrate obtaining a wound drainage specimen. So without further ado, let's get started. So first, I am going to assess the appearance of the wound and also the surrounding tissue of the wound. Okay, so I am going to check. Then next, I am going to assess the character and the amount of wound drainage. And I am going to assess the client's compliance of pain or discomfort. So, ma'am, do you feel any pain or discomfort po? Wala naman. So, then next, I am going to assess the signs of infection. So, ma'am, may mga nana po ba yan or mainit po ba yung wound nyo po? Okay. Okay, so next, gather all the equipment. So I already assembled all the equipment that I am going to use later on the procedure. Then next, I am going to proceed to the procedure. So explain the procedure to the clients and how the clients can cooperate. So for today, ma'am, I am going to perform the obtaining wound drainage specimen. So the purpose of this, ma'am, is to identify the causative organism and help to determine the most effective therapy on your wound po. Then you can cooperate with me, ma'am, by following the instructions later on the procedure. Then next, now I am going to perform the hand hygiene to prevent the transmission of microorganisms from one patient to another. Then next, provide the client's privacy. So before I came here, I already provided the client's privacy to make the patient comfortable and safe. Then next, we can now apply the clean gloves. Then we can now remove any marks of outer dressing that cover the wound. So first, we are going to open the sterile dressing by using a sterile technique. So we are going to open it on this side and on the other side, and discard. Then we can now irrigate the wound of the patient. Then we are now going to clean the wound of the patient. So we are going to clean it to the center to outward. In a circular motion. And discard. Then we can now obtain the specimen. So but first, we are now going to use another gloves to obtain the specimen. So I am going to use another gloves to obtain the specimen. So now I am going to obtain the specimen. So I am going to use this swab. So this is just an improvised specimen tube. So first, open this specimen tube and place the cup up and down on a flat dry surface so that the inside will not be contaminated. Then rotate the swab back and forth over the clean areas of granulation tissue to the side or base of the wound. Then return the swab to the culture tube. Make sure that the specimen tube contain the data of the patient. That includes the time, the date, and also the name, the birth date of the patient, and also the age of the patient. Also the specimen type that I get, which is the blood. Then we can now dress the wound of the patient. So I am going to use the sterile gauze. So we are now going to dress the wound of the patient. and we need to secure it. Then we can now arrange for the specimen to be transported to the laboratory immediately. Then document all the relevant information of the patient. So that concludes my demonstration of obtaining a wound drainage specimen to the patient.